see few things about manual defibrillator, how it's work on the ICU. A manual defibrillator, we know it's a medical device mainly used to treat cardiac problems, and it is used in the intensive coronary care unit that the patient does or have the condition of medical recommendation to deliver voltage shocks to the heart by placing the pads to the chest. And mainly it helps to treat for the patient who are having any cardiac arrest or ventricular fibrillation and ventricular tachycardia. Manual defibrillator. So the manual defibrillator, that is electric shock given by the skillful person, and it's deliver the shock to the patient, that is who is victim of sudden cardiac arrest caused by the heart rhythm disorder by due to ventricular fibrillation or pulseless tachycardia. Parts of manual defibrillator, we can see the monitor. The monitor shows the current ECG waveform, heart rate, and it will show the energy selection, energy delivered, impedance value, and the battery status. The second is the keyboard. So there will be so many numbers of keys will be present, and based on the different names. And we can see the external paddles. So we will be having two paddles. One will be placed on the sternum and one will be placed on the apex. So the paddle may have the function of charging and discharging the energy, and these are the two external paddles helps to deliver the shock for both adult and pediatric patients. So for pediatric, that the external one we will be removing, and inside you can see the small paddles which will be placed on the patient chest of the pediatric patients. And the ECG we should select that lead 3 and V5 leads usually will be selected. It will measure the rhythm of heart, and looking at the waveform only we will be decide whether defibrillation is needed or not. And the battery is needed to operate the machine in the absence of electric current. We need a printer, so have an inbuilt thermal printer, so it is a confirmation. So what we will do at the time of arrhythmias and after giving the defibrillation shock, whether it's the arrhythmia is reverted or what, that will be placed in the patient case sheet, so the doctor can evaluate what time the patient developed arrhythmia and what time it is reverted. Based on that, they can start further management. What are the features of manual defibrillator? First one is energy select. So this is for the selection of energy for delivering to the patient, and the charge button to set the energy level. So we may be keeping the range for 300 to 360 joules, and the shock is nothing but allows to deliver the energy to the patient. So for before shocking, we have to charge the machine. Disarm. This is similar to shock function. So here the energy is internally discharged to the machine, because after charging the machine it will be internally discharging the machine. So discharging internally will reduce the hazard to the patient and the operators. The next is synchronized function. So the synchronized function helps to synchronize the machine. And if you are pressing the synchronized function, then the machine not deliver shock after pressing the shock button. So because the synchronized will peak the orbit. So the synchronized mainly will be used for cardio portion. How to use a manual defibrillator? First, what we have to do, we should switch on the machine and apply the electrode gel to the paddle so that to avoid burn to the chest. And we should select the energy level, that is joule, so whether it's 200 or 250 or 300, that we will be selecting the joules. And then is to we are supposed to do, we should place the paddles on the chest of the patient and place the sternum paddles on the patient chest inferior to the patient's right clavicle and lateral to the upper sternum and place the apex handle in the anterior axillary line inferior and lateral to the patient's left nipple. Whereas in the paddle itself, we can see the red button, that is the charge button. So we can charge the button. And once the charging has been completed, press the shock button to deliver the shock to the patient. And observe the ECG signal after delivering the shock. So if it's needed, if it's not reverted, again additional shock can be given. And once the operation of the machine is over, we have to turn off the machine and clean the machine. And then we should store the machine in a safer place. What are the precautions we have to take while discharging shock to the patient? So do not use any mobile phone near the defibrillator and when any electrical items which is causing radiation because it will interfere with the function of the machine and even we should not expose the machine to the electric and magnetic fields example X-ray, CM or MRI and stay away from the chances of getting the shock hazards and better make sure before shocking the patient, giving shock to the patient, you have to announce everyone that you are going to shock the patient so that they will be stand a little away from the patient. Right? And use the battery of the machine properly. Cleaning. Make sure to turn off the machine before clean it and the machine should be cleaned with a 70% isopropyl alcohol or soap water and even pollens can also be used and we should not use such as kettles or other flammable agents and we are not supposed to articulate the accessories and the machine unless it has been specified and even we should not immerse any paddles to water or any other solution for the purpose of cleaning.